In the context of the potential combination benefit of bevacizumab and atezolizumab, we initiated a trial trying to look for the efficacy of bevacizumab and atezolizumab in patients with advanced HCC. Now, these were patients with advanced, including metastatic or unresectable HCC. They were fairly standard frontline patients. They had a decent ACOG performance status. They had measurable disease. They were required to have no prior systemic therapies. And for this study, we included patients with a Child's Pugh status up to B7. Those patients were enrolled. They were given atezolizumab and bevacizumab every 3 weeks, and they essentially continued until disease progression or until unacceptable toxicity. And the primary endpoint of this study was really safety and tolerability, but also another key primary endpoint was to look at response and efficacy as per investigator assessment. Because the trial seemed to be going well, additional key secondary endpoints were added, including looking at independent review or sort of central review response, just to make sure that we weren't overcalling it by investigator assessment, and also using this modified HCC response criteria, which takes into account the contrast enhancement and arterial phase imaging to get a better look at the liver tumor specifically. The study has so far enrolled about 103 patients who are evaluable for safety and about 73 patients that thus far are evaluable for efficacy. We defined evaluable for efficacy as patients who were on for 16 weeks and had at least 2 serial scans to really feel confident about the responses that we're seeing. And in that context, focusing just on the primary endpoint of investigator assessment, we saw a response rate of 32%, which thus far is actually the highest response rate that's been seen in a combination with a checkpoint inhibitor for first-line therapy for HCC. So we're very excited about that promising result. In addition, when you looked at the duration of the responses and the depth of the responses, they were really very meaningful. And the typical patient who responded actually continued to respond for a long time. So when we looked at our duration of response overall, we haven't reached it yet because most patients who were responding still remain on study. 19 out of 23 patients still remain on study once they had a response. We also saw when we looked by modified HCC RECIST criteria that 8 of the patients actually had a complete response, which is really something that's exceptional for this patient population. And all of the complete responders remain either on study or at least remain in complete response. There was one patient who went off therapy for toxicity, but he remains in complete response.